everybody, my name is Tara Rao, DPT, and I'm here to talk to you a little bit about the purpose of the article. Do various baseline characteristics of transverse abdominis and lumbar multifidus predict the clinical outcomes in nonspecific low back pain? A systematic review. The main purpose of this paper was to conduct a systematic review since it had not been done before. This means the authors reviewed the available research on this topic with the intention of summarizing findings and bringing inconsistencies to light. After review, 5 cohort studies were ultimately included. In the author's words, the primary objective of this review was to summarize the evidence regarding the ability of morphometry, histology, or activation of the transverse abdominis and lumbar multifidus muscles to predict clinical outcomes and low back pain reoccurrence among untreated or conservatively treated patients. Now, in my words, the objective of the study was to understand if the initial characteristics of your core muscles, the transverse abdominis and the lumbar multifidus, big words, core muscles, predict how you will respond to treatment of unspecific low back pain.
Who are the subjects in these studies? These studies included adults ranging in age between 33 and 54 years old. The sample size of these studies included between 25 and 87 participants. In 4 out of the 5 studies examined, they examined patients with chronic low back pain, indicating that their back pain has been there for a duration of time, instead of subacute or acute low back pain, where the back pain is a quicker onset. In the other study, they looked at low back pain that had a variety of time, ranging between 2 days and 24 years of low back pain, with the average patient seen having 186 days of low back pain. Now, these studies also indicated that they did not look at any patients with subacute or acute low back pain. These subjects came from hospitals, physiotherapy clinics, and community advertisements.
In the systematic review, the following interventions were tested. 1. Sling exercises, which were progressive back exercises while the subjects were suspended from slings hanging from the ceiling. 2. Motor control exercises, which involved training and coordinating the deep muscles of the lower back and the pelvic floor muscles, alongside diaphragmatic breathing for greater stability of the trunk. 3. General exercise, which emphasized strengthening and stretching of the main muscles of the body, cardiovascular fitness, patient education, and assigned home exercise programs. 4 and 5, which were spinal mobilization, and spinal manipulative therapy, which was joint mobilization. These interventions ranged from 1 week to 1 year. 4 out of those 5 studies, which were the 1 week interventions, showed less than 80% of onset muscle fatigue immediately after treatment. As for the 5th study, the 1-year follow-up, 79.8% of the onset muscle fatigue had occurred, which implies that the effects of the intervention may not last beyond a year. However, the 1-year follow-up only collected data from half of the participants, so the results should be taken with caution.
Hello, I'm Alex Ojalabi, DPT, and I will be covering the results portion of this literature review. Ultimately, the literature search did not identify any study that investigated the static morphometry or histology of the transverse abdominis or lumbar multifidus in predicting clinical outcomes or recurrence of low back pain in patients with non-specific low back pain. The studies in question wanted to see how these changes would predict in clinical outcomes of low back pain. There were 2 studies of the 5 that touched on this topic. Both could not predict short-term or long-term clinical outcomes of individuals with chronic low back pain. The other 3 studies were unable to report on this topic due to limited evidence. Conflicting predictive results were also noted in baseline percent lumbar multifidus thickness changes.
This is Kieran McQuaid, Doctor of Physical Therapy, and we just want to close with some clinical implications from our Wong article that was published in 2013. So I'm sure you've heard by now, but this article definitely had some limitations. One being the attrition, with only 80% sticking through and reporting outcome measures the entire way. The ultrasound was used as a modality versus the electromyography, which might be a little bit more of an accurate representation of muscle activation, where you can actually see how it's being activated, how much. The other things were the outcome measures. Pain rating scales are a little bit subjective. And the idea of lower back pain as a whole is very, very subjective. So one patient's pain rating and lower back pain differs between every single patient you're probably ever going to see with lower back pain. Now, in terms of assessment, the article did do some very good things about talking about the neurological recruitment or the anticipatory bracing of the transverse abdominis and the lumbar multifidus. So these two measures can be really helpful in the clinic to see if people can protect their spine and their hip before they go to pick something up or to reach for something. Those are things we can test. We can actually feel and we can actually see how their joints are moving and seeing if they have proper body mechanics, inside and outside the clinic. So this article did do a good job of talking about those things. But again, some of those limitations and how they did it and the amount of articles that they talked about and reviewed might be a little bit too much to teach a patient. So for this, we want to keep things simple. We want to take everything with a grain of salt, but if we can grasp onto those things of anticipatory bracing and implications that we can actually help the patients with and teach them and improve upon those measures, then it's something that we can definitely use to help people.